looking towards the future and what it holds for nursing leadership and career paths. In reflection of what we've covered in this class and in looking outside of the healthcare systems and other technological organizations and their view of leadership, this has been an eye-opening experience as I complete the first of my 4 years toward my doctorate as a family nurse practitioner. In the world outside of healthcare, especially in interviewing with Tesla Motor Corporation's senior engineering manager, Gilbert Diaz, it was apparent that technology greatly values their employees and their front line as far as their management. The management tends to envision themselves as a support to those on the production lines, as opposed to the front line holding the leaders up. In valuing their production lines, they not only give respect for the hard work that is accomplished by the front line, but they realize that without the front line, the business would not flourish. In return, the employees trust their leadership is reflected in the quality of work that is produced. In our world of healthcare, in interviewing the Chief Medical Officer, Robin Sneeringer, MD, at my small rural hospital in South Lake Tahoe, leadership changes can be seen in the more innovative direction in baby steps. The obstacles facing small rural hospitals are always going to be the bottom line, cost containment. And until this CMS begins to move towards the future in reimbursements for services such as house calls, video consults in the home, and an expansion of what home health services can provide, it will be the larger hospital organizations leading us into the future. In the interview with Barton Memorial Hospital in California, they are very aware of Nevada's change in this direction. Because Nevada was the 17th state to approve nurse practitioner independence and prescriptive authority, and due to the EMTs and firefighters as the same entity, Northern Nevada now provides medical services in the home through a company called East Fork Fire and Paramedic District. The company now provides house calls by the EMTs with the nurse practitioners at the head of the realm as advisors that give clinical instructions and telephone orders for the patients being evaluated by the EMTs at the patients' homes. This is in the direction towards house calls and the future of home care. Entities in New York City, LA, San Francisco, Minneapolis, and Atlanta have organizations already called Pager, Heal, Retrace Help, and MedZed. They provide services in the home that have MDs or nurse practitioners as the leads and nurses or med techs as their front line, to which the patient is willing to pay for the services that are currently not covered by their insurance. As for my future as a family nurse practitioner, I just completed an interview with the charter school district that uses the RN as the lead, delegating, monitoring, and advising med techs out in the field at 13 schools. No longer are the days of the RN assigned to specific schools individually. This concept of delegation is not so new to the unified school districts, but the concept is expanding in other fields. And this is a good baseline skill to have looking to the future of directing healthcare at home. As soon as CMS begins to see positive results, as opposed to the patients ending up in urgent care or the emergency departments, that could have been resolved in the home, and the insurance cost containment that is so needed, it's easy to see the future of nursing going out into the homes at a fully reimbursable rate. And the reason why I went in for these interviews is because I've moved out of the Barton area and I'm traveling. So I am looking into other types of service that are a little bit more conducive to the future. Thank you.